I'm asbestos attorney Justinian Lane, and I help families affected by asbestos-related cancers like mesothelioma. I made this video because I know that families suffering with a cancer diagnosis have a lot of questions that doctors typically don't have the time to answer. As a cancer survivor, I want everyone with cancer to get their questions answered. Cancer first affected my family when I was 20. My maternal grandfather, Roy, was diagnosed with cancer. We were living in different states at the time, so it took a few days to reach the hospital to see him. He passed away while I was still driving. Roy's wife, my maternal grandmother, Terry, was diagnosed with lung cancer several years later. Terry battled it for about a year before she passed away. I was grateful to see her in person several times before she passed. I can also remember looking around her place and realizing that her remaining time was spent unable to afford basic costs and struck with inoperable cancer. It bothered me, and it never really left me. Cancer came from my family again when I was 30, this time affecting my father, Jerry, who was diagnosed with several types of cancer. He was given 3 months to live, but my dad made it nearly 9 more months. Long enough to watch a video of me graduating from Michigan State Law School. He passed away just a couple of weeks before I got the news that I had passed the bar exam. I hadn't intended on becoming an asbestos attorney. I'm not sure I knew what asbestos was, and mesothelioma was just a word I'd heard on TV. But I was recruited by a law firm in Texas, and some of their clients had been injured by asbestos exposure on the job. In one of my first cases, I represented a pipe fitter who had developed mesothelioma while working at a large chemical plant. As I dug into the case background, I discovered a history that I hadn't heard about. And as a naive new lawyer, the truth at that time shocked me. Having read thousands of pages on the widespread damage asbestos has caused and the corporate cover-up, very little in this area of law shocks me anymore. I realized in my first case that the asbestos industry had known since the 1930s that asbestos was giving its employees breathing diseases and actively told company doctors to conceal it from their workers to avoid lawsuits. Millions of industrial workers were exposed to dangerous amounts of asbestos for most of the 20th century. And among those millions of people who went to their jobs unknowingly exposing themselves to a deadly carcinogen were both of my grandparents and my dad. My mom's father, Roy, served in the Army during World War II, driving landing vehicles used to ferry troops and gear ashore. He spent time on board Navy ships, which in those days had asbestos all over them. After World War II, my grandfather worked in many blue-collar jobs, including as a mechanic. He even got to work on the legendary A.J. Foyt's Indy car. My grandfather changed thousands of brake linings made with asbestos, in cars that often included many electrical, insulation, and other components that also contained asbestos fibers, installing, removing, grinding, and sanding them. And invisible asbestos fibers stick to everything, so millions of spouses, children, and other household members who lived with industrial workers or washed their work clothes contaminated with asbestos also developed mesothelioma and other asbestos-related cancers. When asbestos is brought from an occupational work site to another location, it's called secondary exposure. Dozens of health studies have found secondary exposure is just as dangerous. In fact, it's the leading source of asbestos disease in women. My grandmother Terry was exposed to asbestos working for a number of years operating industrial ovens insulated with asbestos. But she also washed my grandfather Roy's work clothes every day. But Roy and Terry weren't the only people in my family affected by asbestos. My dad, Jerry, spent a number of years working at a company that made titanium. Making titanium involves heat of 1,400 degrees Fahrenheit. That's hotter than a house fire. There aren't too many things that can withstand that kind of heat, but asbestos can. And that meant my dad was working around a lot of it as a young man. The next time cancer affected my family was in late 2023. I had just walked out of the airport and was about to get into an Uber when my phone rang. I answered it and got news no one is ever prepared for. This time, the one in my family who had cancer was me. I had thyroid cancer. Nothing in my life ever made me feel as small and as powerless as that phone call. And you can imagine how my mom, who lost my dad and both of her parents to cancer, felt when I gave her the news that her only son had cancer. As an asbestos attorney, I often speak with healthcare professionals who treat my clients' cancer. It was a bit surreal to be considering my own. I had learned a lot about cancer prior to my own diagnosis, but being diagnosed made me want to learn even more about the tumor inside my body and what it was doing to me. So that's what I did. I read and learned as much as I could about cancer while my doctors figured out my care plan. I want everyone with an asbestos-related cancer to understand the role asbestos played in their cancer and the legal options available to them. If you have any questions after watching this video, please contact us through our website at asbestosclaims.law or give us a call at 833-4-ASBESTOS. Now, let's begin with an explanation of exactly what cancer is and how it affects our health.
A textbook definition of cancer would be something along the lines of, cancer is a group of diseases involving uncontrolled cell growth. Our DNA is a set of instructions that takes us from being a fertilized egg no bigger than a grain of sand, all the way into becoming a full-grown adult.
When we're still growing in the womb, our DNA tells our cells how to develop into our organs and tissues. Even after we're born, our DNA continues to guide our cells by instructing them when to divide, repair, and even die to allow for replacement with new cells.
For example, when you get a cut, your DNA springs into action to heal the wound. It sends signals to the stem cells around the cut to start dividing and producing new cells to replace the damaged ones. So the skin heals. This intricate process encoded in our DNA ensures we can recover from injuries and our bodies maintain all normal functions.
But sometimes, the instructions encoding these processes become altered or lost because the DNA encoding them gets damaged.
The cell has to make an exact copy of the DNA. And in the process of division, where the cell is essentially copying the DNA, mistakes happen.
When this happens in cells, they may begin to divide in an uncontrolled manner, without any balance or restraint.
Most mistakes are non-consequential, meaning that they're not likely to cause a problem. The majority of our DNA is not coding for something important. But the more we make mistakes, you're likely to make a mistake that actually makes a difference. That's what we call the driver mutations, the mutations that are more likely to cause a cancer.
When these rogue cells multiply, they can form a mass known as a tumor.
And that's essentially what cancer is, an accumulation of mistakes. And these mistakes in your DNA will then release the brakes off of your cells.
Normal cells are programmed to die after a certain amount of time as specified in our DNA. This controlled and planned process of natural cell death is called apoptosis.
Apoptosis is what happens to embryos, for example, so that they can be reshaped. Without apoptosis, our fingers would be webbed. So apoptosis is an important process. It's part of the normal life cycle of our cells in the body.
However, cancer cells evade the natural process of apoptosis and survive much longer than they should.
Now let's go back to that cut. Normal skin cells live 2 to 3 weeks before dying off and are replaced, ensuring the skin heals properly. But if cells in the cut were cancerous, instead of dying off through apoptosis, the cancer cells would just keep accumulating, eventually forming a mass or tumor. But not all tumors are cancerous.
A benign tumor continues to divide and it grows and it lumps together, but it's not affecting your nearby tissues, it's not invading them, and not affecting the body. Cancerous tumors, on the other hand, are aggressive. They do tend to invade the surrounding areas and can sometimes also, little pieces of that lump can break off and spread into other parts of the body, spreading the cancer so that it can start growing and dividing somewhere else.
Our cells are very good at catching these mistakes and correcting these mistakes, but some will seep through.
Malignant tumors, just as they find a way to avoid dying and they find a way to divide uncontrollably, they also find ways to create their own supplies of blood.
The cancer cells are recruiting more blood vessels so that they can have their own blood supply so that they can grow even more. In fact, credit to the term cancer is given historically to Hippocrates. It is called carcinus either because it aggressively latches on like a crab, or maybe because of the abnormal blood supply makes it have this tentacle-like appearance.
They also are able to turn on and off different parts of the immune system, and that also affects the way that the body looks at those cells, because though they're causing a lot of problems, the immune system is not recognizing them as a problem.
That's why I tell all my patients cancer is a disease of time, because the older you are, the more cell divisions you've had, and therefore the more mistakes are likely to have accumulated in your DNA.
If it weren't for commercials from asbestos attorneys, most people would have never even heard the word mesothelioma. That's because although it's a very serious kind of cancer, fortunately, it's also very rare. Between 2,500 and 3,000 people each year are diagnosed with mesothelioma in the US. By way of comparison, there are over 300,000 new cases of breast and prostate cancer each year, and I was one of the 94,000 or so people diagnosed with thyroid cancer each year.
Mesothelioma can present in varying locations with a name given to that location. The lungs are the most common location for mesothelioma, but there are other areas that can be affected.
What I tell my patients is mesothelial cells, it's the skin on the inside of your body. It covers your lungs and it covers your chest wall. Those are called pleural mesothelial cells. On the inside of your abdomen, those are peritoneal mesothelial cells.
The lining of the lung also goes to other parts. It goes down to the diaphragm, which is the muscle that controls your breathing. And the problem is, when people get mesothelioma, eventually it also can go on the other side of the diaphragm, which is the abdomen.
The most common type of mesothelial cell cancers actually happens in the lining around the lungs.
The abdominal cavity, or the peritoneum, is the second most common spot for mesothelioma.
Mesothelioma can occur in some rare areas. There's rare reports of mesothelioma of the pericardium, which is the mesothelial layer that's covering the heart, and mesothelioma of the testicle, which happens definitely less than 1%. I've only ever seen one patient with testicular mesothelioma in my practice. Now, of course, there are certain things that can make it more likely for you to have mistakes in your DNA.
We still don't fully know what causes someone to get cancer. There are certain genetic syndromes and specific mutations that can lead to a higher risk of developing certain types of cancer. Smoking, different toxic exposures.
If you're exposed to an environmental toxin, like asbestos, for example, that can make mistakes more likely to happen.
When you take a breath in, particles from the atmosphere that you might inhale travel through your entire upper airway into your trachea, which is the main windpipe connecting to your lungs. So the body has a number of defense mechanisms to deal with inhaled substances that shouldn't be there. Cilia, which are hair-like material that sweeps foreign debris out into the larger airways so that they can be coughed and removed. Unfortunately, asbestos fibers, because of their particular size and shape characteristics, are able to avoid this defense mechanism and as a result are not cleared from the airways. Asbestos differs from other toxic substances because a material like ammonia gas or chlorine gas causes an immediate response that your body is very much aware of right away, and you remove yourself from that stimulation. You walk out of the room, you open up windows, and so forth. Asbestos is odorless, colorless, you're not coughing, you're not feeling unwell. You have no idea that you're inhaling it. The fibers are long, narrow, and spear-like. As a result, they travel all the way to your right and left lung into increasingly smaller airways called bronchioles, and that eventually can pierce the alveoli and get embedded in the lining of the lung. Those asbestos fibers don't get removed. You're not really aware of the response, but in the background there's inflammation occurring. The purpose of inflammation anywhere in your body is to attack some toxic substance. And on balance, inflammation can help your body, but it has side effects.
In the context of mesothelioma, asbestos exposure generates inflammation that creates a favorable environment for tumor growth. Inflammation dramatically increases free radical production. Free radicals are highly reactive molecules that can bind to and damage other molecules in cells. Your body is also actively trying to repair whatever damage is happening at the time. And then it comes to a point where it just builds up and your body's not able to kind of match up with or continue to repair. It becomes overwhelming and leads to cancer.
Insidiously, asbestos diseases can take several decades to appear. That's what's known as the latency of asbestos.
And the problem is when people get mesothelioma, it's not noticed right away. It's very subtle.
Compared to other cancers, such as breast cancer or thyroid cancer or leukemia, where the period of latency is maybe 2.5 to 5 to maybe 7 years, mesothelioma's latency is from about 20 to 50 years. You may have been exposed to asbestos 20 to 30 years prior to even having any symptoms.
Asbestosis, the most common lung disease caused by asbestos exposure, results in dyspnea, or shortness of breath. Lung scarring blocks gas exchange, which is the primary function of the lung, oxygen in and carbon dioxide out. In addition, it also blocks passage of blood through the lung vessels, so that it backs up and causes right-sided heart failure. Mesothelioma most commonly affects the lungs and the lung cavity. It's called pleural mesothelioma, and the most common symptom of that condition is a pleural effusion. It's important to understand that the lung is constantly expanding and contracting by virtue of inhaling and exhaling. As a result, it's brushing up against and contracting slightly from the chest wall. The lining of the lung and the lining of the chest wall are specialized cells referred to as the mesothelium in order to allow a frictionless interface.
The function of mesothelial cells is to keep all the internal organs lubricated and so that they can slide against one another. As you can imagine, if you're having cells that are forming tumors inside your chest cavity and around your heart, that will affect your lung function. It will restrict your lungs' ability to move in and out. It will take up space that used to be taken up by your lungs.
The lining of the lungs, the lining of the chest wall. Those cells leak fluid. This fluid compresses the lung from the outside, which makes it difficult to breathe. The next most commonly reported symptom was shortness of breath. Pleural effusion is extremely common and occurs in 90% of patients with pleural mesothelioma, which occurred in 79% of patients. Pleural mesothelioma often presents with chest pain, and this pain can sometimes radiate to the shoulder, spine, neck, or jaw. Chest pain and related discomfort is frequently felt only on one side of the body. Many patients also report coughing as a symptom of their pleural mesothelioma. The cough is frequently persistent and unrelenting and may be associated with blood. The most common symptom reported for peritoneal mesothelioma is ascites, which is the medical term for fluid buildup in the abdomen. Similar to pleural effusions, ascites can result in discomfort, bloating, and swelling. Weight loss is also one of the most common symptoms of peritoneal mesothelioma, followed by abdominal pain. Both of these symptoms are commonly found in other illnesses, so they're not a reliable indicator of mesothelioma. While pericardial and testicular mesothelioma are extremely rare, it's worth knowing what those symptoms could be. The primary symptom in those locations relates to the collection of fluid where fluid doesn't normally belong. The heart itself sits in a sac called the pericardium. Pericardial mesothelioma causes fluid to fill within that pericardial sac. That fluid puts pressure on the heart and can cause chest pain, heart palpitations, or shortness of breath. Testicular mesothelioma, or mesothelioma of the tunica vaginalis, often presents with testicular swelling and pain. A hydrocele, or fluid buildup in the sac surrounding the testicle, is another symptom. Once again, these are nonspecific symptoms and are common in many other conditions, making diagnosis challenging. Fatigue and night sweats, with or without fever, are also common symptoms of all types of mesothelioma and many other cancers.
If you've been exposed to asbestos or are experiencing any of these symptoms, it's crucial to consult with a physician, as early detection can make a significant difference in treatment.
The diagnostic process often begins with medical imaging.
So mesothelioma is typically diagnosed when a patient comes in, they actually present with common cold symptoms, a dry cough, but then after failed attempts at treatment, the doctor may order a chest x-ray.
A chest x-ray may be the first test to reveal abnormalities that suggest prior asbestos exposure.
And then we would ask more along the lines of what their occupational history is. We tend to ask questions such as, where did your parents work? Where did you work? It's very important to look at a patient's work history when diagnosing any type of cancer. It's more important for mesothelioma because asbestos is usually found in about 90% of mesothelioma cases.
Having worked in a VA hospital in the past, we've seen a lot of patients who were in the military and worked on ships and had exposure to asbestos in that setting. So we're always on the lookout for veterans having been exposed to asbestos, even when they're coming in for routine imaging studies, such as just chest x-rays for symptoms or for a pre-op evaluation.
Indirect exposure is another way that someone can get exposure to asbestos. Cleaning the clothes of someone who worked in the industries is actually a common way that people will be exposed to it, but not necessarily know that they were exposed. And that will lead the doctor to do further and extensive imaging for a diagnosis of mesothelioma.
When the body is damaged by asbestos fibers, it responds by forming hard fibrous tissue that presents itself on the imaging as pleural plaques. And when we see pleural plaques, the patient may have had asbestos exposure. And typically, if you had those findings and the patients have risk factors for asbestos-related pleural disease, including mesothelioma, you would want to further image that patient with a chest CT scan. The mesothelium is a very thin membrane surrounding the lung tissue. And for this reason, areas of abnormality that form along the mesothelium can be difficult to see with just a plain X-ray. So that's why we need specialized imaging techniques, including high-resolution CT scans. Another tool used in diagnosing mesothelioma is the PET scan. And the benefit of doing a PET CT scan is that you can actually look for areas of cancer in other parts of the body because we image the entire body from head to toe.
Cancerous tumors are dangerous because, just like some invasive plants, cancer cells don't always stay in one place.
Abnormal cells in the tumor can break away and directly invade surrounding normal tissues, where they gain access to blood and lymphatic vessels. They can travel throughout the body and establish new colonies of cancer cells there.
This process of cancer cell dissemination is known as metastasis. The cancer cells that break away, travel, and grow successfully in distant body sites are known as metastatic tumors or simply metastases.
So mesothelioma obviously can cause a lot of problems locally, but also mesothelioma can spread to the other lung, and it can spread to other organs like the livers, adrenal glands, or to the abdomen, rarely even to the brain.
So all of these imaging techniques can reveal pleural thickening, fluid, or masses that may suggest mesothelioma. However, imaging alone can't provide a definitive diagnosis because infections and other benign pleural processes can also mimic mesothelioma.
The gold standard for diagnosing mesothelioma will then be a biopsy.
Typically, the surgeon that you're speaking with has a suspicion of what the diagnosis is. But like everything in medicine, a suspicion isn't good enough. The doctor is going to try to confirm that. The way one confirms any diagnosis that's based upon tissue is to examine it under the microscope. The pathologist is trained at looking at the telltale signs, and then they can determine the specific nature of the problem.
Combining radiological findings with pathological information, actually looking at the cells, doctors can more accurately diagnose mesothelioma. The type of biopsy procedure performed depends on many factors, including the location and accessibility of abnormal tissue. When pleural effusion is the presenting sign, the pleural fluid can be collected through a procedure called thoracentesis.
Pleural effusion, you may recall, is the fluid collection between the lung and the chest wall. It puts pressure onto the lungs and it makes breathing difficult.
Thoracentesis requires insertion of a needle into the pleural space to withdraw fluid.
By removing the fluid, we can improve pain and discomfort. Separate from treatment, it can also be a useful tool for diagnosis. We can then take that fluid, send it to the laboratory, have it spun into a centrifuge. Those cells can be looked at under a microscope. And sometimes in that manner, the diagnosis can be confirmed.
Now, mesothelioma is not only classified on where it occurs, there are different varieties of mesothelioma.
Doctors classify mesotheliomas into subtypes by examining the cells under a microscope to see what the cells look like. There are three main subtypes of mesothelioma: epithelioid, sarcomatoid, and biphasic or mixed mesothelioma.
Epithelioid mesothelioma is the most common form, accounting for approximately 50 to 70% of cases diagnosed in a given year.
The encouraging aspect of epithelioid mesothelioma is that it tends to spread more slowly and responds better to treatments like surgery, chemotherapy, and radiation therapy.
Sarcomatoid mesothelioma is the next most common type, representing about 10 to 20% of cases diagnosed each year.
Sarcomatoid mesothelioma is the most aggressive form of the disease. This type often spreads quickly to other parts of the body, including bones and soft tissues, and is more resistant to standard treatments.
Unfortunately, due to its aggressive nature and treatment resistance, sarcomatoid mesothelioma is usually associated with a poorer outcome. The next major mesothelioma type is biphasic or mixed mesothelioma, which accounts for about 20 to 30% of cases diagnosed each year. It contains a combination of both epithelioid and sarcomatoid cells.
The behavior and prognosis of biphasic mesothelioma largely depend on the ratio of these cell types.
If the tumor has a higher proportion of epithelioid cells, the prognosis is generally better, and the disease may respond more favorably to treatment.
Asbestos is a group of naturally occurring fibrous silicate materials found in certain rocks. It's extracted from ore by a milling process. Throughout the 20th century, asbestos was used in industrial work sites and in millions of homes and other buildings around the world.
Industrial use of asbestos was widespread for firefighting, automotive and boiler work, parts manufacturing, as well as construction, shipbuilding, electrical, and metalwork, just to name the most common uses. Asbestos was used commercially because it has a number of unique properties. For one thing, it's fireproof. One of the first recorded uses of asbestos in history was as a wick for a lamp in ancient Rome. And for a number of years, Zippo even used asbestos wicks in their lighters. Asbestos is not only fire-resistant, but it's a great insulator against heat. Asbestos is also non-conductive, so it could be used in electrical applications without fear of sparks. That's why it was used in so many televisions, radios, toasters, hair dryers, and even electrical panels. Asbestos also acts as a great filter, which is why for many years wine and beer manufacturers used asbestos filters to purify their products. Up until the 1960s, the medical community knew very little about the cause of mesothelioma, primarily because it was such a rare disease. That all changed with the groundbreaking work of Dr. J.C. Wagner in 1960. Wagner published a study titled Diffuse Mesothelioma and Asbestos Exposure in the Northwestern Cape Province, examining 47 cases of mesothelioma in South Africa. Wagner's study was among the first to establish a strong link between asbestos exposure and mesothelioma. This prompted further research, including significant work by Dr. Irving Selikoff in the United States. Selikoff published Mesothelioma and Asbestos, revealing that mesothelioma was 344 times more common amongst insulators than the general population. It's now widely accepted in the medical community that asbestos exposure is the primary cause of mesothelioma, with most experts agreeing that it is responsible for more than 90% of all mesothelioma cases. The textbook Neoplasms of the Pleura states that, quote, "The incidence of mesothelioma is usually considered to reflect a society's past per capita usage of asbestos." Author Paul Broder described in his 1968 article, "There's not an automobile, airplane, train, ship, missile, or engine of any sort that does not contain asbestos in some form or other, and it has found its way into literally every building, factory, home, and farm across the land." There are 6 types of naturally occurring minerals that are classified as asbestos. The most common type of asbestos is a mineral called chrysotile. This is chrysotile, which was also known as white asbestos for obvious reasons. Chrysotile fibers are fluffy, soft, and easily woven into objects like fireproof gloves, asbestos ropes, even asbestos oven mitts. Now, this is amosite asbestos, and although its fibers are much longer than chrysotile fibers, they're more rigid and less flexible. One of the primary uses of amosite was in insulation, especially on the kind of Navy ships that my grandfather served aboard. And in this jar is a sample of chrysotile asbestos from Africa. Although all types of asbestos can cause cancers like mesothelioma, chrysotile is considered the most carcinogenic. Chrysotile was used extensively in cement pipes, especially those used to transport water.
There was a day where the treatments for mesothelioma was quite limited, maybe a couple of decades ago, and there wasn't much that we could offer patients.
Historically, mesothelioma is aggressive and often treatment resistant.
And while mesothelioma still is a very aggressive disease, and that much has not changed, our treatments have significantly changed.
Before the turn of the century, mesothelioma patients were often limited to best supportive care and single-agent chemotherapy with modest survival benefits. But a better understanding of cancerous tumors has led to new methods of treatment with more improved outcomes. There are 3 traditional types of ways that we treat cancer: surgery, which is the process of a surgeon actually going in and physically removing tumors; chemotherapy, the use of drugs that specifically target the particular parts of the cell where they divide to allow for the cells to die; and then we have radiation. A radiation oncologist will use different types of radiation to destroy those cancer cells in the body.
Based on the stage and the type of mesothelioma, we can then start to think about what kind of treatment we can offer. When it comes to mesothelioma, it's making sure that you have a mesothelioma, and whether it's epithelioid type, sarcomatoid type, or a biphasic mesothelioma. Once we know that, then we want to know what stage is it at. And the stage really, when it comes to pleural mesothelioma, is dependent on how much of your inner lining is involved, whether it's involving the other side, whether it's has spread somewhere else in the body.
Stages 1 and 2 are more amenable to surgical treatment, where it hasn't spread beyond the cavity of the lung, and so it's still resectable. Once it spreads beyond the lung cavity to other parts like the diaphragm, then it becomes a later stage, 3 or 4.
As you can imagine, a disease that has spread is not going to benefit from surgery. Most commonly, patients will require some form of systemic treatment.
Ensuring that patients receive the appropriate treatment and care based on an accurate diagnosis requires multiple doctors from different areas of medicine. This is called a multidisciplinary approach, and it's critical in order to provide excellent care of mesothelioma patients.
There's different types of cancer. The way they develop, they're in small areas, and in their areas that are accessible by surgery. The alternative to surgery are things like chemotherapy and radiation therapy, which affect the whole body. So if you can remove it without causing any other significant problems, it only affects that area of the body.
The difficulty with mesothelioma lies in the fact that, for example, unlike a skin cancer where you could potentially just have one spot on your skin that you're able to just cut out before it has spread, imagine mesothelioma as a cancer that is involving your entire surface.
The lining of the lung, it's like a piece of saran wrap covering a lung, and that's where the mesothelioma occurs.
And that makes it really difficult to treat with surgery alone.
It can grow all around the lining of the lung and easily get into the lung. That same cavity, that same lining also goes to other parts.
Now, by no means is surgery the go-to option in patients with mesothelioma. However, when it is an option, it is usually in patients with the epithelioid type of mesothelioma, patients who have very limited disease, either limited to a portion of the lung or the inside of the chest wall. Surgery can be quite elaborate.
It's not uncommon for people to have parts of the lung removed, even one whole lung removed, and the other lung compensates. The body is very good at that.
More commonly, we're not able to remove everything, and we normally need to do something else to help with that.
As human beings, as doctors, we have certain limitations. So when we go and look at a tumor, it's like if you see a tennis ball, you got the little furry edges around it, and you go and take it out, but some of those little pieces of fur, maybe you left them little pieces around that you couldn't see. It's the same thing with taking a tumor out. Unfortunately, those little pieces are usually cells, and if they're cancerous cells, then they can start growing again.
And that's why we generally will give some sort of systemic treatment or cytotoxic treatment, immune therapy, or add radiation when surgery is involved.
Chemotherapy is what people think of when they know someone has cancer. They're like, oh, they're going to have to get chemo for short. And everyone knows it to be fairly toxic, and patients usually have significant side effects.
Chemotherapy are chemicals that affect rapidly dividing cells.
There are a lot of different types of chemotherapy, but the drugs themselves, they target the different parts of the cell cycle and the ability for the cell to grow and divide.
Because cancer cells are more likely dividing than not, the chemotherapy is more likely to kill cancer cells than healthy cells. Cancer cells are not the only rapidly dividing cells in our body. Your hair is constantly growing, or the cells that are lining our GI tract, our colon, those are also rapidly dividing cells, and those can sometimes get caught in the crossfire.
And so a lot of the side effects that you see from chemotherapy, with hair loss or diarrhea, vomiting, is because those cells, your hair follicles and your cells lining your gut and your mucosa, those are also cells that divide very fast, just like cancer cells. The chemotherapy drugs aren't able to differentiate between what's cancer and what's normal. Another issue in treating and preventing cancer is that many aggressive cancers evolve to evade one type of chemotherapy known as treatment resistance. So if you treat with one chemotherapy drug, they're going to figure out a way to stop that drug from interfering with their ability to divide. And that's what we call treatment resistance. In the early 2000s, new combinations of chemotherapy were developed that showed improved response rates and life expectancy. So that's why usually we'll treat with more than one at the same time, because that ultimately is harder for the cells to overcome. New options for mesothelioma are on the horizon, including mesothelin-targeted therapy, which involves drugs that specifically focus on the molecular cells, gene therapy, which tries to repair or replace defective genes, cryotherapy, which uses extreme cold to destroy cancerous tissue, and immunotherapy, a groundbreaking approach which works by boosting the body's immune system to improve its success at recognizing and attacking cancer cells.
Perhaps the most significant advancement has been in immune therapy that has been able to help the patients with the most aggressive type of mesothelioma, the sarcoma type of mesothelioma.
Immunotherapies tend to be less toxic than chemotherapy and limit treatment to the cancer cells without damaging the adjacent healthy cells as much as chemotherapy can. Your immune system protects you every day, whether you feel it or not, from pathogens, bacteria, viruses, different things that can invade the body that are not supposed to be there. And your body just kind of silently clears it through a very elaborate process. Your body will mark something as abnormal, and that will alert your immune cells, your T cells. Cancer cells, they can actually prevent those markers from being placed on them. And so immunotherapy essentially tells the immune system to see those cancer cells as foreign.
It allows our own immune systems to fight back against cancer. And of course, everything comes with side effects. Immune therapy sometimes could take the brakes off too much, and our immune system could start attacking our own normal cells, just like chemotherapy. So nothing is a magic bullet. But we really, when it comes to survival, we have seen some remarkable effects. A lot of these novel approaches are being studied right now, and we always encourage our patients with mesothelioma to ask about clinical trials. And just to explain, these clinical trials, these agents don't usually move on to clinical trials unless they've shown significant promise in the lab. And it's clinical trials like these are the ones that made it possible for immune therapy to be part of the mainstay of treatment of mesothelioma in the past 6 years or so.
It is important to understand that immunotherapies can be associated with autoimmune side effects, and all immunotherapies are currently very expensive. Speak to your healthcare provider about what options are available and right for your condition.
There have been big improvements in how doctors treat mesothelioma, giving patients and their families more hope. Doctors have developed ways to detect the disease at an earlier stage so treatments can be more targeted and effective. Chemotherapy has also improved, now extending survival for many patients. Researchers are also creating therapies like immunotherapy and mesothelin-targeted treatments, which focus on killing cancer cells while protecting healthy ones. On top of that, experimental treatments like gene therapy and new clinical trials are giving people more choices. These advancements mean that even though mesothelioma is still a serious disease, there's real progress being made to improve patients' lives. Even with such improved treatments, the price tag for fighting mesothelioma can be overwhelming for families. Bills for surgeries, chemotherapy, hospital stays, and other care add up fast. Insurance helps, but doesn't always cover everything. Many families face extra costs like traveling to treatment centers, staying in hotels, or paying for special home care. That's why it's important to know that legal help is available. Families can seek compensation through asbestos trust funds or lawsuits against companies responsible for asbestos exposure. This money can help pay for treatment, lost wages, and other expenses. In my line of work, the word latency refers to how long it takes after your exposure to asbestos before you get sick from it. But I've thought a lot about the latency between the actions we take in our life and the consequences. Choices we make in our lives can affect the lives of others long after we're gone. Few things illustrate that as well as the asbestos story. I and many others lost our fathers and loved ones in the 21st century because a group of men in the 1930s decided to cover up the health risks of asbestos for as long as they could. The legacy they left the world was mesothelioma, even in people exposed to asbestos as children, washing a parent's work clothing. In the last weeks of his life, my father worried a lot about the legacy that he left for my mother and me. There wasn't enough money to make sure that Mom would be taken care of. I was deep in debt from law school and was still awaiting my bar exam results. I've seen that same worried face on many of my clients. Most of my clients are hardworking men and women who, like my father and grandfather, were never able to save as much money as they'd hoped, especially with medical bills, which unfortunately account for a lot of the household bankruptcies in America. Sure, I'm an asbestos attorney, but what I really do is ease the financial worries of families who've been affected by asbestos and a mesothelioma diagnosis. We offer our clients much-needed financial relief, but no hard sell, and get families access to the counseling, estate planning, and other support they need. You can contact us anytime, day or night, and we're happy to provide a free consultation, video or in person, whatever's convenient for you, with no upfront costs and no legal fees until you've received your compensation. It's been almost 20 years since my father passed away, but I think of him every day. I think about my own legacy and what I will leave behind. I'm proud to have helped many of my clients leave a legacy of their own and some peace of mind that their families will have some of the support needed to deal with a cancer diagnosis. I never expected that I'd end up in a cancer fight of my own, but it has taught me a lot about not giving up, about what really matters in life, the people we care about, and asking for help when you need it. I know I couldn't have gotten through my battle alone, so if you could use some support, give us a call, because no one fights cancer alone.